Hi viewers, this is Dr. Iftikhar Islam from Pakistan. Today I'm going to present a lecture on bovine spongiform encephalopathy, which is also known as mad cow disease. Prions are the smaller than smallest known virus, and they have not yet been completely characterized. The most widely accepted theory is that the prions are mutated proteins, although not all the scientists accept that they are the cause of disease. Professor Stanley Prusiner, the Nobel Prize winning scientist who first proposed that the prion proteins could cause disease, says that today a wealth of experimental and clinical data proves his ideas were right. The idea of protein-only infectious agent was first proposed by Griffiths in 1967. However, it was only after the co-purification of the prion protein with the hamster scrapie infectivity that the Prusiner was able to distinguish it from a virus. The normal protein is designated as PRPC. The C stands for the cellular. The glycoprotein is normally found at the cell surface and is inserted in the plasma membrane. The first confirmed case of BSE occurred in 1986 in United Kingdom. Following that discovery in the 1988, the UK banned meat and bone meal products rendered from the ruminants from inclusion into the cattle feed. In 1989, the United States Department of the Agriculture banned the importation of live ruminants and most ruminant products from the countries that were known to have BSE. Major efforts were made to stop the spread of the disease in the UK and continuing today. Currently, it is thought that the people who ingest BSE contaminated food products may develop variant Creutzfeldt-Jakob disease. The first confirmed case of this disease occurred in 1996 in UK. The incubation period for this disease is unknown because it is a relatively new disease, but it is likely to be many years or decades. Therefore, a person who develops this disease likely would have consumed an infected product or products many years earlier. In contrast to the classic CJD disease, the variant form of this disease in UK predominantly affects the young people, with 26 years as the mean age at the onset of the symptoms, ranging from 12 to 74 years of the age. The mean duration of the infection once clinical signs begin is 14.1 months, that is from 6 months to 2 years for variant Creutzfeldt-Jakob disease. Variant Creutzfeldt-Jakob disease has atypical clinical features with the prominent psychiatric or sensory symptoms at the time of clinical presentation. Onset of neurological abnormalities is delayed and include ataxia within weeks or months. Dementia and myoclonus occur late in the illness. Affected persons generally become completely immobile and mute at the end stage of the disease. There is no effective treatment for variant Creutzfeldt-Jakob disease, although there is experimental treatment taking place. The supportive treatment and supportive care are recommended in this case. From 1996, when the first suspected cases of variant Creutzfeldt-Jakob disease occurred, to 2009, 217 cases of variant Creutzfeldt-Jakob disease have been reported worldwide in 11 countries. As of 2009, 170 cases have occurred in the UK. There have been no confirmed cases of variant Creutzfeldt-Jakob disease originating in the United States. Mathematical models have been used to try to predict the magnitude of the human infection. These models predict anywhere from the hundreds of people being infected to the hundreds of thousands of people developing the disease. Given the unknown incubation period and the consumption rate that may have occurred, there could have been more variant Creutzfeldt-Jakob disease cases in future. The United States government has a number of stringent safeguards in place to prevent the spread of BSE in the United States of America. In 1989, they banned the importation of live ruminants and restricted many ruminant products from the countries where the BSE was known to exist, including the UK. These regulations were expanded to include all of the Europe in December of 1997. The USDA implemented the ongoing Bovine Spongiform Encephalopathy surveillance program in 2006, which focuses on being able to detect the BSE at one infected animal per 1 million adult cattle with a high degree of confidence. This program will sample more animals than what the OIE recommends and collect the samples from the cattle's populations where the BSE is most likely to be detected. Those with CNS signs greater than 30 months of age with BSE signs injured, non-ambulatory, dead with the goal of 40,000 per year. From September 2006 through June 2007, 30,141 samples were collected. No positives were detected. Due to the serious economic and public health implications of this disease, authorities should be notified immediately of any suspicious cases of BSE. Meat from the animal should never enter the human food chain. The brain and medulla should be submitted for necropsy, and the carcass should be properly diagnosed of. Use extreme caution while extracting the brain so as not to expose yourself. While waiting for the confirmatory diagnosis, all the suspectory animals should be quarantined. Proper disposal of all the subject's animals is essential so that their products are not allowed to enter the human food chain. Well, with this, we are going to end our today's lecture. Thank you for watching this video.